Today we're going to demo the universal curet. The universal curet can be used in the posterior or anterior. It has two cutting edges, one on each side of the terminal shank. It has a rounded toe, and the face is 90 degrees to the terminal shank. You have 3 universal curets in your kits. You can choose any of them to do your process on. When working on patients, it will depend on the location, anatomy, depth of the pocket, as to which of these curets would work best for each situation. Prior to working with your universal curet, you will take your patient's vitals, complete your intraoral and extraoral exams. You'll have your PPE on, and you'll have all of your armamentarium out and ready to go. Next, we're going to determine the correct working end. Here we go. To determine the correct working end in the posterior, you will take the instrument and place it interproximally so that the terminal shank is parallel with the interproximal surface. If your handle comes out of the mouth, that is the correct working end. I will show you the incorrect working end. If I put this in here, my handle is resting on her cheek and it's not coming out of her mouth. So again, this is your correct working end because the handle's coming up and out of her mouth. So for a curet, we have to make sure that we insert subgingivally with the blade closed. Several things could happen if we try to insert into the sulcus with the blade open. We're going to cause some trauma, and that's not going to make our patient feel very good. So to close your blade, you'll start at your distal line angle, because just like your scalars, we're going to move distally, and then we will reinsert and move mesially. So we are going to lean the face of the instrument and hug that tooth. So we're going to pivot with our fulcrum. We're using our modified pen grasp. Our fingers are together. Our handle is resting between that second and third knuckle. We'll zoom out just a little bit to see that. Okay. So starting at the distal line angle, I'm going to pivot on my fulcrum to flatten or to hug that tooth. I insert into the sulcus. I pivot again on my fulcrum to become parallel. And I take a few strokes as I roll to go interproximal. We want to keep our cutting edge less than 90, but greater than 45 to ensure deposit removal. Once I get interproximal and I can't go any further, notice I'm not completely parallel through that contact. We're not completely parallel, we're a little bit closed. When I can't go any further, I close completely and I slide out of the sulcus. Then I'll insert at the mesial line angle, the distal line angle. We're going to close, insert, pivot to open, rocking motion around the lingual, rolling and rocking using my pivoting, coming interproximal, not completely parallel. Then we're going to close and come out of the sulcus. You'll do the same thing on the facial surface. To show an example of how your hand and your fulcrum would sit on a maxillary premolar area for the universal curet, you'll fulcrum on the tooth closest to where you're working. If you need to extend or shorten your grasp, that's okay. You're using a modified pen grasp. You're pivoting to close. You're inserting distal line angle with a closed blade. I'm pivoting on my fulcrum. I'm going to rock, get interproximal, can't go any further. I pivot up to close that blade, and then I come out. reinsert at the distal line angle, close my blade, open my blade, use my wrist motion, steady on my fulcrum, rolling, coming up on my fulcrum, interproximal, close, and exit.